getting as many people vaccinated as you can, and then you will see that number of cases per day will go down to a very low level.
As Dr. Fauci just said, more shots means fewer cases. And as you can see from this chart, the number of COVID cases is falling fast. The average now 30,000 per day, the lowest we've seen in nearly a year. And fatalities are also falling to the lowest level since last summer. That as nearly 2 million Americans are getting the shot every day, with 4 in 10 people in this country now fully vaccinated. More than half the states now have at least 50% of their adult populations fully inoculated. And as you can see, most of them, they're in blue states. Now, that jives with this recent poll that shows that 82% of Democrats say they've gotten the shot, but fewer than half of Republicans say the same thing. Now, it can't help when prominent Republicans like Senator Rand Paul say not only have they not gotten the vaccine, but they are refusing to do so. A research group, it has studied why certain people are hesitant, and it has grouped them into 5 categories: enthusiasts, the watchful, the cost anxious, and the system disruptors, as well as the COVID skeptics. It found that 8% are watchful and waiting to see what happens, 9% cost anxious, meaning they want the shot but can't afford the time or the cost even though it is free, 4% they don't trust the system altogether, and 14% are COVID skeptics. Now, it looked at the data, and it also did so by state. As you can see from this graph, deep red states like Arkansas, North Dakota, Louisiana, they lead in COVID skeptics. I want to bring the director of programs for the group that provided all this data, Hannah Kemp of Surgo Ventures. She joins us now. And Hannah, I was a little surprised that the number, while it might have been the biggest category, that only 14% are COVID skeptics. The others, they have their different reasons, but one would think they could be convinced.
And that's actually what our hypothesis as well. You know, we thought it was important to really understand the distinct population segments of, whether they're going to get vaccinated and why, so that we can be more precise in their response. The groups that you just outlined, the watchful, the cost anxious, the system distrusters, they actually all need very different interventions in order to help them to get vaccinated. The watchful, for example, they need to see that their friends and their family are getting vaccinated. They need to feel that it's a social norm. The cost anxious, they need their employers to let them have a day off, to help manage the side effects if they have any, or also just to know that the vaccine is free. Actually, we saw that a surprising number of people didn't even know that the vaccine was free. The system distrusters, this group actually needs community-based organizations to reach out to and to be able to interface with to gain their trust. And the COVID skeptics, we may be able to not convince all of them, but we may be able to convince some of them. COVID skeptics, 50% of them actually trust their own doctors. And so, this is a really, I think, under-leveraged channel for reaching COVID skeptics, is people's personal doctors sharing what is the data, what does the facts say about the vaccine.
Hannah, is there a commonly accepted magic number that if we get to X for the total population, we actually get to that herd immunity?
I mean, that's a great question, and that's something that scientists have been going back and forth. I think, what we're looking at is how do we help the country get to Joe Biden's number of 70% by July 1st? And what we really see is a need to take a precise response. What worked to get to 50%, which is around where we're at right now, is not going to work to get to 70%. And how do we actually reach each one of these groups with distinct interventions and activities and different messengers?
Of the number that I would think is the low-hanging fruit is the cost anxious, in that, it's free. Now, granted, some employers may not be amenable to letting somebody off for a day from work or whatever else, but it would seem, if there was messaging that nobody's going to dock you a day of pay if you go and get the shot, or we're going to make it as simple or as convenient to do so, that's 10% almost right there.
Yeah. And actually, if you look at certain states, it's even higher. So in Mississippi, 23% of the population is cost anxious. That's actually the highest in the country, followed by West Virginia. We need the leadership of these individual states to actually come out with some of these messaging and to work with the employers of these in these states to say, hey, you can take a sick day. We'll provide paid leave. I've heard, many employ large organizations, Trader Joe's, for example, doing that, but we need more.
In terms of the watchful, I'm curious, from what they've seen so far since the rollout, are they more likely now to get the shot, or do they look at every little strand in a story where, there's a tiny percentage that may have had adverse effects of it, but in the big scheme of things, you're more likely to be struck by lightning twice than to die from the vaccine? Like, how do they read the news as either hopeful or cautionary?
That's a great question. I mean, I think, for the watchful, there's going to be different things that convince them. What we saw was that the watchful, yes, they pay attention to the news, but they also really pay attention to what their friends and family are doing. So, if you've got a person who falls into that watchful care category and they see their Instagram or their Facebook feeds, being having all the tags, let's get vaccinated, or they talk to their friends and their friends are getting vaccinated, this is actually more likely to convince them.
I'm curious, which approach works better, from the carrot or the stick? And I say that because, I'll speak personally, but I got no problem when I'm seeing these cruise lines say, if you're not vaccinated, you're not getting on board, because it's going to impact the security or the confidence that the rest of the passengers are going to have, especially when you're on a contained thing like a vessel for more than a week at a time. Others, I'm saying, are doing the carrot approach, where they're having, you could win $1 million in the lottery, theoretical, or you're going to get other enticements if you get it. In terms of the goal of getting people to get the shots in their arm, which works better?
Oh, that's a really tough, loaded question. We have advocated for, let's understand why people are hesitant and then help them get over that, rather than mandating, but what is the intervention that they need to get vaccinated? So, for a group like the watchful or even the cost anxious, the idea of lottery tickets or a shot in a beer or a chance to win Lakers game tickets, that may work well. But for other organizations, I'm hearing, health systems, right? Major health systems are mandating that all of their employees get vaccinated. And that may make more sense in the healthcare setting.
Hannah, are you, after completing this study, more optimistic that we're going to get there, or when you see some of the coverage that you do that feed into these conspiracy theories, or will take a strand of information and populate it with so much more misinformation just to create even more distrust in the public, especially now when they say, hey, wait a minute, I was on the fence here, I was in one of these categories, but I can go to a ball game anyway. Why do I need to get one now? Which camp do you fall in as we're getting into summer? And again, the hope that I know you and I share, that as many Americans as possible actually get the shot.
I will say that, for me personally, I'm more of an optimist. In general, I am an optimist, but I think what this data is showing us is that the majority of the country actually aren't COVID skeptics. They believe that the virus is real, and that the reason why they're not getting a COVID shot is not necessarily because, they believe a conspiracy theory on Facebook. It's because they want to see other people go first, or they can't take time off of work, or they may just not have much contact with the health system and therefore don't trust it. Those things are much easier to overcome than to change someone's deeply held beliefs, say, about, vaccines in general.
I think it was a fascinating study you guys did. Hannah, I appreciate a few minutes. Thank you so much.
Yes, thank you.
All right, everyone, when we come back, we will pivot to the world of sports and show you how history was made on the golf course yesterday. We'll have that after this.